2 weeks ago, I did a story about how antibody testing could provide a roadmap to reopening by identifying who might have developed immunity to COVID-19 and who still might be vulnerable to infection. I took you through the process of a rapid test. Dr. Lisa Larkin's team in Mariemont has been offering the simple finger stick in drive-thru testing as part of an internal review board approved research protocol. Of her 1,035 tests so far, 44 people have learned they're positive for antibodies, which should mean they fought off COVID. The others have tested negative. Critics say because of the onslaught of COVID-19, the FDA is allowing companies to make antibody test kits available to the public before FDA approval. Just 8 of those test kits have gotten emergency use authorization. It is one reason Dr. FICHTENBAUM, who's in the infectious disease division at UC, cautions consumers. Can we trust the tests that are out there right now?
No. We should recognize that we need a little bit more data and time to be sure it's truly accurate and providing the information we want. So we can trust and we should verify.
But Dr. Larkin says ignoring data, even if it's imperfect, seems like ignoring dark storm clouds before a storm. She joined us by Zoom to elaborate.
Robust debate is very, very important. And again, I'm all about evidence-based medicine and I'm all about having FDA-approved tests. I just want to reflect, though, that having a little bit of data, even if it's not 100% perfect data, is better in some circumstances than having no data.
Especially when, in your words, we're flying the plane as we're building it, right?
Yes, for sure. In this study, there's 2 reasons to collect this data. One is to inform us as a community about the prevalence of antibodies, so we have a sense if we have enough herd immunity as we go to open. And I can tell you that at least in the prevalence data that I have from this study, again, probably not perfect because of false negatives and false positive rates, our antibody prevalence is low. So at least we get a flavor that our population is at risk for having a second peak once we open.
Dr. Larkin says the test she's offering, as you heard, has had false negatives, but 43 of her 44 cases of positive antibodies came with classic COVID-19 symptom verification. One was a healthcare worker who could not get a diagnostic test. She followed quarantine rules, went back to work, and then got the antibody test, which Dr. Larkin says showed possible active virus. Listen in.
Spoke with her, I spoke with her boss, we sent her for confirmatory testing, and guess what? She was positive. She needed to stay off work because a positive swab for RNA suggests viral shedding, and she really shouldn't be in a clinical care setting where she's exposing our most vulnerable patients, the elderly.
So that's something we learned. Another thing that we learn when somebody tests positive for antibodies is that they might be able to donate convalescent plasma, correct?
That's right. And right now we have been scrambling to look at effective treatments.
She says patients who tested positive were happy to know they could donate plasma. Now, Dr. Larkin would like to follow up with folks who got tested for antibodies and offer up voluntary testing to confirm the data. She also has 1,200 people on a wait list, but she's waiting to see which antibody tests get authorization from the FDA to find the best one for patients going forward. Final thought here. We still do not know for sure if antibodies confer immunity with COVID-19.